I'm Dr. Sodimu. I'm a consultant psychiatrist with the Lagos University Teaching Hospital. I'm here to educate us about mental health. Mental health includes our social, emotional, and psychological well being. It includes the way we act, the way we feel, the way we relate to others, and how we can make healthy choices. If we cannot do some of these things, then one can say that the person has a mental health disorder. So sometimes some types of mental health disorder include anxiety disorders, depressive disorders, eating disorders, addictive disorders or substance use disorders, and of course suicide. To talk on one of these, let me talk on suicide. So, suicide is the act of killing oneself, and it has been quite prevalent worldwide. In fact, studies have reported that in every 40 seconds, somebody kills or somebody commits suicide. Someone kills oneself. That is how prevalent it is. So, in some there's different types of there are different causes of suicide, and this includes psychological causes, which includes the depressive disorders, substance use to psychotic illnesses can predispose one or prompt one to commit suicide. For instance, if somebody notices that they've not been feeling happy persistently, they have been feeling very down, lack of energy over a period of time, and things that he or she previously enjoyed doing, the person do no longer enjoy doing this. Such symptoms could be a depressive disorder, and it can be treated. Once this is quickly nipped in the bud, it does not go on to be complicated as hopelessness, worthlessness, and then the person starts having suicidal ideation, and then the person commits suicide. Also, some other psychotic symptoms like hearing voices or saying strange things, particularly the hearing voices. Now, some people could respond to a command given by a voice of a person they cannot see, or voices that have been tormenting them, telling them how they are good for nothing or how they don't amount to anything. This accumulated over time could push one to committing suicide. Another thing that will cause suicide includes substance abuse. Substance abuse includes using some substances like cannabis, like cocaine, tramadol. These people they want to get high, and either knowingly or unknowingly they take high doses, which ultimately results to death. How can we prevent suicide? Suicide can be divided into prevention. Suicide prevention now can be divided into what government can do to help us reduce this menace of suicide and what we can do to ourselves individually. On the individual part, I think that if we are our neighbor's keeper, when you watch out for others, when you notice some things like this person used to be vibrant before, and then all of a sudden the person is withdrawn to self, the person doesn't come out to gatherings like he or she used to. Or the individual oneself too, as if you notice that you are persistently sad and you don't seem to be able to come out of it. This when one feels these symptoms, one should, seek help. We have different treatment for these mental health disorders that doesn't necessarily need one to go on to commit suicide. Another way that we can do to prevent suicide individually is by loving oneself, self care, self love. We can only love ourselves as much as we want. Nobody can love you the way you want to be loved. So, improving our self esteem and self confidence, appreciating our self worth and self value will ultimately reduce the thought of suicide or even the act of suicide eventually. Then to look into then other healthy habits that one could also have is eating healthily. Eating healthily doesn't necessarily mean eating expensive food, but adding fruits and vegetables and some other nutritious things into our diet. This could help our mental health and decrease thoughts of suicide. On the governmental part, I think that removing suicide as an illegal action should be one of the most paramount things that the government can do for us, because anybody that commits suicide now in Nigeria has committed a crime. This has reduced the people coming forward to report these incidences. It has reduced the fact that the relatives cannot come forward to seek help, because not even only the crime there, also the stigma. Other people view this culturally, how we think that suicide is culturally unacceptable. Of course, it is, but we have to embrace the family and help them to forge forward. And of course, reducing unemployment rate as how best the government could and other things could go a long way to reduce the prevalence of suicide. How can we treat mental health disorders? We can treat mental health disorders by first identifying. Some people don't even want to reckon. Some people don't even believe that there's anything called mental health disorder. I think that's the first cross that we should, or the first hurdle that we should cross, so that we know that yes, there's something. Don't look at the next person thinking that you're just too lazy, you just don't want to do it, get a hang of yourself. That person could have a psychological disorder that you are not even aware of. So once we are able to identify that, the person should be brought in for treatment. There is a non-profit initiative by the Lagos University Teaching Hospital, which is supplying suicide research prevention and prevention initiative. It is targeted at the population, the general public, and of course our members too here. So if you notice or you see somebody, or even if oneself too sees that they need help, they can call. We have hotlines which will be posted on the website, so they can call these lines and a professional will talk to them, reassure them, and then refer appropriately to one of our clinics. I hope this has been educative and beneficial. Thank you.